everyone. In this video, I'm going to be talking about a not so common condition that can affect pregnant women in the earlier or later stages of pregnancy. The reason I'll be talking about this is because at my last prenatal visit that I had at the perinatal center, the doctor noticed that something was a little off with my ultrasound and brought this to my attention. It's something that I've kind of been doing a lot of research on and worrying about at the same time as I do with most things. But I just wanted to kind of educate everyone on this kind of condition. If this is something that you might be experiencing in pregnancy or think you might be experiencing in pregnancy, it's definitely good to know. So the name of the condition is called preeclampsia, and what it is a restricted blood flow to the placenta or the uterus. The symptoms include high blood pressure, protein in the urine, swelling of the hands and feet. Those are the most typical symptoms of it. But there are also other symptoms including blurred vision, headache, nausea, rapid weight gain as well. It can lead to slow growth in the fetus and low oxygen supply to the placenta, which of course is not good. Mothers who have it, who are pregnant, can experience seizures and even death in more severe cases of the issue. Severe cases can also lead to damaging other organ systems in the mother, often the kidneys. The exact cause of preeclampsia is not known, but the most likely people to get it would be if you have a history of preeclampsia in any previous pregnancies, if this is your first pregnancy, if you are over 40, if you're carrying twins or multiples, if you have a history of high blood pressure, history of migraine headaches, diabetes, kidney disease, blood clots, or lupus. These are all factors that make you at higher risk for developing preeclampsia during a pregnancy. In severe cases, it may require induced labor and delivery. As far as treatment goes, aspirin is recommended. A low-dose 81 milligram baby aspirin, I can't even talk today, is recommended to take daily to help thin out your blood so that it'll more easily move into the placenta and the uterus, which will hopefully cure the problem by 20 weeks. The condition is not officially diagnosed until you are about 20 weeks. Like I said, the key aspects they look for when diagnosing it would be the protein in the urine and the high blood pressure, but nowadays those aren't the only symptoms that they look for. So when I went to the perinatal center and I had my sequential screening and my ultrasound, when the doctor came in, he said that everything looks good, the baby is growing right on target, but it looks like that the blood flow to my uterus looks like I could develop preeclampsia later in my pregnancy, which of course made me very concerned. He did start me on a daily aspirin regimen, 81 milligrams that I have to take once a day. So now that's the iron-free prenatal vitamin I have to take every day, the stool softener to help with constipation, and now the baby aspirin to try to cure and or prevent the preeclampsia from developing. They're going to recheck me at 20 weeks, and hopefully by then it will have cleared up and the blood flow will be moving properly and there won't be any issues. It's definitely something that I'm concerned about. It definitely has me losing a little bit of sleep at night. But in most cases, I researched that when they catch it early and you start treating it early and properly, they are most likely able to cure it in time, and you'll be able to have a normal, healthy pregnancy, which I'm sure that's what every pregnant woman wants. I believe that's all the information that I have on preeclampsia. If you or someone you know is having any of the signs or symptoms of it, who is pregnant or thinking about getting pregnant, and you have a history of the things that could lead to preeclampsia, definitely bring it up to your doctor or your OBGYN. No question is a dumb question when it comes to talking to your doctor. So I hope that this video was educational and helpful for everyone. I'm also updating, of course, my friends and family on what's going on with me personally, but to anyone else out there, I hope that this has helped you in some way. That's all I'm going to do for this video. My next video, I promise, will be a little bit more uplifting and fun. We'll see you next time.